This conference will now be recorded.
Welcome in, everybody. On today's lecture, we are going to be talking about emergency medical services operations. So this is in correlation of a state of readiness. This kind of ties into our quality assurance, quality improvement, and then also making sure that we're providing the best quality patient care that we possibly can. So first, we got to prepare for either the ambulance call if we are working within a transport service, or working within a fire department or a rescue squad in which we are a non-transport service. So first, beginning of our shift, we want to make sure that all of our supplies and equipment are in a state of readiness, checking those expiration dates on any medications or nasal airways, King Airways that you might carry, and make sure that you have all the equipment ready. Now, it happens to everybody where somebody goes on a call previous to, they have a massive trauma event, a cardiac arrest event, and maybe they miss a couple of things when they are restocking. So it's always best practice to go ahead and check over all of your equipment at the beginning of your shift, or if you're in a volunteer status, to go in periodically and do equipment checks, bag checks. Next, we're going to ensure the readiness of whatever apparatus that we might be on, whether it's an ambulance or a fire truck, going through our system checks with the engine on, with the engine off, and again, making sure that all of our equipment is in a state of readiness. So when we are doing a check, make sure that it's thorough. We should be following a rubric. Depending on who our operations manager is, they should provide us some type of documentation that when we are checking that truck, it should be systematic as far as who's checking that truck. Variety of different ambulances here in between type 1 and type 4. And then also our fire engines. Again, be familiar with the apparatus that you are responding on. So when we are responding, we want to make sure that we are providing good team dynamics, and where the call originates from, unless that call is actually made specific to the ambulance service or the fire department that you're working on, this is going to be the role of the emergency medical dispatcher. So they're going to find out where the exact location is. And remember, based on how our 911 technology correlates in our area, we have basic 911, enhanced 911, and advanced 911. So if we're operating within a basic 911 service, the caller has to provide the exact location of that patient or of that emergency. If it's an advanced or an enhanced 911, we can either see the pinpoint longitude and latitude of that caller, or where the closest cell phone tower actually originated that call from. They're also going to provide a callback number for you. So in the event that you arrive on scene, maybe you're not able to get into that location, or maybe with the chaos of that scene, that caller actually didn't provide the correct address or correct information. So that's always a good call, or excuse me, a good number to have in the event that you need more information. They're also going to generate what the problem is and then how old the patient is. So you're going to get your general impression based on your emergency medical dispatch. Now that's always system to change as well. Then they're going to go through some 3 basic questions, and then they are going to tier their response based on that. So if the patient is unconscious, has any difficulty breathing or chest pain, then that's going to be an automatic dispatch. If the patient is conscious, breathing, and does not have any cardiovascular related event, chances are they're actually going to gather more information for you prior to actually dispatching you. So when we're operating the ambulance or operating the fire truck, or even our POV, if we're responding from home, always make sure that we are driving with due regard. So we are liable for any laws and regulations that are set forth by state statutes when we are operating an emergency vehicle. So make sure that you're familiar with that specific state statute in regards to how we operate an emergency vehicle in an emergency setting. When you are using warning devices, it's all or nothing. So if you're going to be driving with lights, you have to have your sirens on, and vice versa. So you can't pick and choose. I know it's customary for a lot of individuals, if it's in the middle of the night, they're just going to be driving with their lights on. But per state statute and per law, if you are operating with your lights on, you also have to have audible sirens going on as well. When you are approaching an intersection, make sure that you change the tones, because other drivers are more susceptible to changes in those tones in comparison to how loud that siren actually is. With speed and safety, again, drive with due regard. A lot of data and statistics out there demonstrate that even though you are driving at a certain speed, you're really not saving that much time depending on where you're actually traveling to. So drive in a safe manner with proper speed, because when we're traveling at an excessive speed, our reaction time is greatly sacrificed. When we have multiple emergency vehicles going on, make sure that you're driving with a good buffer, because a lot of individuals, they'll see an emergency vehicle driving by, they'll pull over to the right, and then they don't even think to check to see if there's another emergency vehicle actually traveling. So make sure that you get a good buffer zone going on, and then also be cognizant of those individuals who do pull over to the right. Always keep in mind your factors that are going to affect your response, such as travel, your distance, any weather considerations, and then also keep in mind too what you're responding to. Don't drive like a crazy maniac if somebody calls 911 for toe pain, but you might have to travel at a little bit faster speed when you are responding to a cardiac arrest event. So based on our system that we're operating in, a lot of individuals and organizations will use the CAD system. CAD system is extremely nice because it gives us a lot of information in regards to the call, and then also the location of that call. Then depending on how advanced your CAD system is as well, all of your call demographics will actually be transmitted directly into your medical report, which again is extremely nice. So we arrived on scene, we provided patient care, and now the next thing that we need to do is transfer that patient to the ambulance. So reflect upon our lifting and moving, and then also using good communication and proper carrying devices as far as selecting that device in order to mitigate that scene from that patient position to the stretcher and then into the back of the ambulance. Package that patient for that transfer, so make sure that you're using all of your seat belts associated with that stretcher. Use good body mechanics when you are lifting that patient, and making sure that all of the safety mechanisms are actually locked into place. Then when we're preparing that patient for that transport, so it is in best practice that we should be seat belted in when we are providing patient care in the back of the ambulance. That driver, make sure that you're driving in a safe manner. You don't always have to go lights and sirens to the hospital. Oftentimes it's actually better to actually drive with no lights and sirens, and that way your individual who's actually providing that patient care in the back can do a proper assessment, can talk to the patient, and then also that brings down the anxiety a little bit of your patient. So when you are in the back of the ambulance, go ahead and continue your assessment. Secure that stretcher into place. Make sure that that locking bar is actually in place so that stretcher isn't swinging around. Adjust the straps as necessary, making sure that that patient is still secure, but in a way that you can still do any type of intervention that you might need to do, whether it's proper airway management or vitals checks. Loosening constricting clothing, oftentimes this is best done when you are on scene, such as if a patient has a heavy coat on or a sweatshirt on, go ahead and remove that prior to actually getting in the back of the ambulance so that you can do blood pressure checks or maybe assist with IVs if you are in that capacity. Load any personal effects that they might want to bring along, and then also make sure that those personal effects get transferred with that patient to the ER, and then document that within your narrative or within your PCR. Talk to that patient, reassure your patient, communicate with them as far as what interventions that you are doing. Again, that builds that patient rapport between yourself and your patient. A lot of individuals will just sit in the back and then go ahead and fill out their report. Try not to do that. There is a time and a place for it, but remember, the patient comes above else. So caring for that patient en route, we're going to go ahead and notify the hospital and give our radio report to them. Provide that any emergency care is needed, any interventions. If you have a drastic change within your patient condition after you gave that pre-hospital care report, make sure that you update that hospital with changes with your patient. Always use safety practices. Again, you should be seat belted in. There's a lot of injuries and deaths that have occurred to EMS personnel when they are actually transporting a patient. Compile additional information. This is going to be best for your report, and then also best for that hospital being able to actually get that. When we do transfer that patient, we're going to go ahead and get them into a best position possible. Again, we're going to be using best lifting techniques. Some hospitals, depending on how busy they are, might direct you to have that patient go into the triage system. Other patients who are a higher risk are going to go ahead and go directly to the emergency room, where you're going to be directed into a room and there's going to be staff waiting upon your arrival. Make sure that staff is listening and ready to go as far as getting that patient report. Make sure that they're listening, and then you can go ahead and give your verbal handoff report. During that verbal handoff report, that's where we're actually going to see a transfer of care take place between yourself as an EMS provider and then that hospital staff. Now, depending on if you're transporting, you will also need a release from the hospital or release from that patient for proper billing techniques. So make sure that if that patient is conscious, go ahead and have them sign your report for you. After termination of that call, clean that patient report, or clean that ambulance, clean any equipment that you may have. Make sure that you restock any equipment that you did use and be in that state of readiness, because you never know when that next call is going to go ahead and come in. If you are a non-transport service, you can do a equipment and change with that transport service. So if you used an OPA or a bag valve mask, what have you, make sure that you're going ahead and switching that out with that ambulance service. And then when you're back in service, make sure that you radio that to the emergency medical dispatcher. Air out the ambulance. Maybe you have a smelly patient, what have you. And again, make sure that that ambulance is in a state of readiness. Once you're back in quarters, go ahead and complete your PCR. Again, clean, disinfect anything that might need more cleaning than what you were able to do at the hospital or when you were at scene. And again, get that equipment ready for you. Then for air rescue, this is going to be a part of your EMS operations as well, because we work very closely with that air rescue. So this is a great video that LifeLink put together for us. So instead of me lecturing on it, we're going to go ahead and watch this video.
Helicopter and airplane services for on-scene emergency and inter-facility transport of patients requiring critical care. LifeLink 3's mission is safe and effective air medical transport. Safety, customer focus, and excellence are among the core values of our company. Because LifeLink 3 is committed to the highest level of safety during all helicopter and fixed-wing or airplane operations, it's vitally important that our procedures and protocols are fully understood and followed. We rely on you, our valued partners, to keep everyone on the ground and in the air as safe as possible. When calling for patient transport, key pieces of information are needed to facilitate the request. What is the reason for transport? What's the address, cross street, or GPS coordinates? Who is the ground contact? What is the radio frequency at the scene?
Ram Captain 2 to Lifelink helicopter on STAC 12. Your landing
Identify
zone
a landing zone coordinator known as the LZ coordinator to facilitate a safe landing zone. The coordinator oversees the entire scene and is the sole ground contact with the Lifelink 3 helicopter.
Your patient is critical but breathing. You'll get a report from the ambulances.
Lifelink 3 Communication Center confirms landing zone and radio contact frequency. If necessary, Lifelink 3 makes these arrangements and notifies the local dispatch center to relay information to the incident commander.
County 4115.
In Minnesota, the helicopter communicates with the LZ coordinator on STAC channels 1 through 12. In Wisconsin, on channels Mark 1 or 2. When communicating with our helicopter, the LZ coordinator provides the flight crew with the following information. Location, including major landmarks and highways. Description of the landing zone, surface, size, and shape. Any hazards such as power lines, slopes, obstacles, trees, loose debris, and hazmat petroleum or chemicals. Use the term abort if a dangerous situation develops during approach. As a reminder, smoking is prohibited around any helicopter or aircraft.
Your landing zone is going to be...
When requested for a scene flight, Lifelink 3 moves resources toward the area. If the helicopter arrives before the scene is secured, Lifelink 3 stages a safe distance from the scene until the landing zone is secured. If at any time your assessment of the patient dictates that air transport is not necessary, the LZ coordinator may cancel the helicopter. For scenes with multiple patients, more than one helicopter may be requested. When that occurs, pilots communicate between aircraft and notify the LZ coordinator if 2 landing zones are needed. Landing zone preparation. The landing zone should be at least 100 feet by 100 feet and located on a firm, level surface. Aircraft cannot safely land on excessive slopes. The landing zone should also be located at least 100 feet from the patient. Keep emergency personnel back 100 feet as well, and spectators need to be at least 200 feet away. Roadways should also be blocked by emergency vehicles to prevent traffic from coming near the helicopter. Clear the area of any debris and obstructions, including objects that may become airborne due to the rotor wash. Rotor wash can produce hurricane-type winds and may pick up small objects, possibly causing injury, and can damage the aircraft or vehicles. The area should be clear of trees, signs, posts, power lines, and large rocks. If power lines are close to the perimeter, park emergency vehicles under the overhead wires if possible to assist the pilot in locating them. Also, notify the pilot immediately if drones or model aircraft are present. Also, keep in mind that Lifelink 3 helicopters will land and take off into the wind. Landing zone preparation at night. When preparing a landing zone at night, mark the 4 corners with low-beam vehicle lights, rotating beacons, or secured battery-powered lighting. If lasers are used, never direct lasers above the horizon or toward the aircraft, and never use flares. Emergency vehicles could also be used at the 4 corners with headlights pointing to the center. As an addition, you may place a 5th light on the edge of the landing zone on the side from which the wind is coming. This communicates to the pilot which direction the wind is coming from. No matter if it's a day or evening incident, personnel on scene should wear protective clothing whenever possible, including hearing and eye protection. After the helicopter crew receives final information from the landing zone coordinator, the pilot lands in the designated landing zone. Prior to landing, the pilot may conduct a low-altitude reconnaissance pass or hover, looking for additional hazards. On occasion, pilot assessment of the landing zone may require an alternate landing location. Once the helicopter has landed, do not approach it unless escorted by a flight crew member. Then always remain within view of the pilot. Only approach and depart the helicopter from the side. The most dangerous area around the helicopter is the tail rotor at the rear of the aircraft. It's virtually impossible to see the tail rotor while the aircraft is running. The LZ coordinator designates a tail rotor guard to ensure no one approaches the rear of the aircraft. Position the tail rotor guard 50 feet behind the aircraft, remaining in position until the aircraft departs. Even if the aircraft is shut down, the LZ coordinator and tail rotor guard must stay with the aircraft. Patient loading. Check that the patient is not in possession of mace, pepper spray, firearms, hazardous materials, or dangerous items. Then, upon receiving the patient report and conducting a rapid assessment, the crew loads the patient into the helicopter. When assisting in patient transfer, follow all flight crew directions. Secure all equipment, including linens, medical equipment, and bags. All items, such as IV poles, must remain low enough to pass beneath the rotor blades. Approach the helicopter from the side with direction from the flight crew and depart from the same side.
So we're going to unstrap her.
Load the patient feet first into the helicopter. Allow the flight crew to close and secure doors and compartments. Once the patient is on board, the crew performs a final safety and security check prior to departure. The LZ coordinator and tail rotor guard must ensure the landing zone remains secure until the aircraft safely departs. Fixed-wing aircraft ground safety. In addition to a fleet of helicopters, LifeLink 3 has a medically configured airplane ready at all times. This type of transportation may be an option for patient transports greater than 150 miles, or if helicopter transport is limited by weather. If fixed-wing transportation is needed, LifeLink 3 Communications Center will coordinate all aspects, including ambulance transport to and from the airports. Do not approach the airplane while it's running, if any lights are flashing, if the doors are closed, if the pilots are still in the cockpit. Keep the ambulance at least 50 feet from the aircraft until signaled by the flight crew to approach. Once cleared, the vehicle should always remain a minimum of 1 vehicle length from the closest part of the aircraft, and never back the ambulance up to the aircraft without a flight crew marshaling the vehicle. Upon approach, turn off flashing lights and beacons. Only use running and clearance lights. If possible, turn off the engine to limit exhaust fumes during patient transfer.
And right shoulder thing.
When moving around the aircraft, use caution to avoid contacting the propeller, winglets on the tip of the wing, and all probes on the front end of the wing. Probes may be heated, which can cause burns upon contact.
As we slide you in here.
Allow flight crew to direct patient transfer and assist only when instructed to do so. Keep in mind that only the flight crew can operate the aircraft doors. After patient loading, clear the area but remain on airport grounds until the airplane becomes airborne. If patient condition changes or additional assistance is required, the airplane may return to the airport. Protocols and procedures explained in this video are meant to keep everyone on the ground and in the air safe. We rely on you, our valued partners, to fully understand what it means to create and operate a safe landing zone. LifeLink 3 would like to thank you for working with us during these critical situations. It requires all of us working together to consistently maintain high safety standards. LifeLink 3's transportation services are accredited by CANES, ensuring the highest standards of quality and safety are met on every flight. For more information on LifeLink 3 and safety-related information, please visit our website.
So that does it for EMS operations, and I will see you next time. Thanks, guys.